Chemotherapy is designed to target fast-growing cancer cells. But the problem is that it's not specific for cancer cells. And that's because we've started to develop what we call targeted therapies, drugs that specifically block the mutation that's in a particular person's cancer that drives that cancer. And so by blocking the mutation that's driving the cancer, we're seeing very high levels of effectiveness and much lower side effects because the drugs are specific for what's driving the cancer. And so in the clinic, what we see now are drugs that have substantially improved the percentage of patients who are cured of their cancer or are able to control a patient's cancer for many years, all with much lower levels of side effects. So patients can continue to live the life they had before they had cancer. In fact, just in the last few years alone, studies led by Yale Cancer Center physicians have led to the approval of 4 of these targeted therapies, to making sure that all of our patients have access to these targeted therapies that are really personalized for each person's individual cancer type. To do this, most of our patients have the DNA of their tumors analyzed so we can identify which mutations are driving their cancer and therefore tailoring that treatment so it's attacking that particular mutation. And we're not just looking at how specific drugs work in a particular person's cancer, we're also focusing on managing side effects of treatment, making sure we're using the right dose and adjusting that dose and using other supportive therapies. So we are absolutely committed to making sure that all of our patients have access to these latest therapies targeted for their particular cancer. And here at Smilow Cancer Hospital and the Yale Cancer Center, we've really worked very hard and put lots of resources into making sure that we're doing really the cutting-edge clinical trials, both here in New Haven as well as all of our network sites. And right now we have over 250 trials testing these latest drugs. So the hope is that with all of these trials that patients will have both access to the latest treatments and eventually we really will make a huge impact on how cancer is treated